people say to me, well, what do I need to do to improve my microbiome? I say, I'm sorry, you already know.
Yeah.
Everybody already knows. It's actually quite simple.
So, but here's the rub.
But it's tough.
But it is tough. So here's the rub, right? Is that generally our guts are not very happy. So if you have a patient, like I see a lot of people with what we no longer call IBS, so irritable bowel syndrome, and they come and see me, and I say to them, look, it's really simple. All you got to do is put 7 more grams of fiber per day in your diet and not do these things. They say to me, either A, I'm already doing that, and actually I'm not very well with it, I'm quite unhappy with it, or they'll say to me, if I do that, my life will be unbearable. I can't do that.
What you need to do is give, can I say this these days? I think I can. You need to give 10 of our capsules and then they'll reset the microbiome within 3 days.
Well, there you go.
I can say that.
Well, you probably can say that.
Yeah.
So you've got some evidence.
We've got some evidence now, yeah.
So that's the problem.
Yeah.
The bigger problem, of course, is that it's got nothing to do with the microbiome. The bigger problem is that you've got very, very large, very well-funded companies with very, very overwhelming marketing campaigns, creating mixed messages and inadequate regulation to protect the consumer from these things. And so the microbiome is sometimes its own worst enemy. It gets misused, it gets misrepresented, it gets missold. That's because people, coming back to the very beginning of our conversation, they're in a rush to commercialize it.
Yes.
And they don't really understand, how it really works.
But also, people, they go on the internet and they type in, how do I improve my microbiome? They'll read an article that says probiotics. Okay, they Google probiotics, so they use some other search engine. And for a non-scientifically aware, trained person, they'll see some beautiful marketing that says, 10 billion CFUs, clinically evidence-based, some nondescript thing that's not really a claim, and they go, okay, I'll use that. And I get it quite a lot. People send me a photo of something, I've never seen it before, and they say, is this good? And I say, well, probably not, to be honest with you. And it's a shame, because it's overwhelming for people. They want a quick fix. Yeah. But unfortunately, there isn't really a quick fix, is there? It's a lifestyle change.
So there's a couple of really interesting points you've raised in that one question. So the first thing is that probiotics are not drugs, and it's a living system, and therefore it's not quick. You're dealing with, microscopic organisms that need tender, loving care and nurturing, and there is no quick fix. The second problem is that you're right. The marketing language is, I don't know if I can use this language on this podcast, but it's bullshit.
Yes.
And so you've had this kind of marketing of good and bad bacteria.
Yep.
There is no such thing as good and bad bacteria.
It's context.
We shouldn't anthropomorphize our microbes. There are pathogens that will totally cause you harm, and there are mutualists and commensals. And the problem with good and bad bacteria is that if you treat your mutualist badly enough, well, you'll get sick.
Yes.
They will bloom and they will cause you harm. Like all microbes under the wrong circumstances, if mistreated, will cause you harm. And it sets us up. It takes away any of the nuance in what we're really trying to do, what we're trying to achieve. And then the third problem is that we don't target these, probiotic agents at all. So if your billionaire example, well, in fact, one of the things that we do, I do it in my clinical practice, like you've got to measure the microbiome to know what's missing, to know what to give back.
Yep.
But we just don't target them. So a lot of primary care physicians, nutritionists, dietitians don't have any basic education on probiotics. They don't know which microbes to give when. The consumer's completely overwhelmed.
Yep.
And then we give no instructions on how to take probiotics. So actually, you're trying to get these microbes to engraft in the gut. And most of these microbes are not really supposed to be in the human gut. So what that means is that you've got to take them really consistently. You've got to take them every day, and you've got to take them sometimes for up to 12 weeks to get to what we call engraftment, so that these bugs will actually consistently grow in the gut, and you'll be able to reap the health benefits from them. Most people just don't take them that way. And then the final problem is that, of course, these probiotics are also heavily marketed. They're usually very expensive. They're usually on some very expensive subscription model.
Yep.
And either patients are sort of guzzling them intermittently, spending quite a lot of money, or they're having side effects. And so quite often patients will come to my clinic and they will sit down and they go, look, I've been taking X brand. I've got this awful bloating, but it's doing me good. So I'm just, I'm still going with it. I'm like, well, why? Stop.
Yeah.
It's not doing you good. You're in pain. You're suffering. I spend quite a lot of my time taking patients off probiotics.
Wow.
I use them in my practice.
Yeah.
But they're a tool. And they should be used in a targeted way to solve a very specific problem. And I think that is what's going to happen with probiotic technology. So again, coming back to one of your earlier questions, I think we are now on the verge of next generation probiotic therapies, which will not be food stuff. So at the moment, probiotics are regulated as foods, and the health claims are based on, the ability to identify very specific, strain-specific mechanisms that are mechanistically or causally associated with a health benefit, which is very, very hard to do. So most commercial probiotics are foods that make wellness claims that are very broad and non-specific. The future is next generation probiotics, which actually do make wellness, health-based claims on evidence, and actually I think they'll be regulated like medicines. So the FDA will say, no, this is a medicine and it will be prescribed.
Very often I get kind of a grumpy, skeptical investor or pharma executive say, well, is it ever going to be as good as changing your diet? Precision, next generation probiotic. Yes,
it is. Because there's a couple of reasons for that. As big an advocate as I am for diet and health, diet requires sustained behavior change over time. And it's really expensive in a cost of living crisis. And it's really hard to do. And if you can get to a single strain that has a very precise mechanism, that has a very specific health effect that you can give in a more cost-effective, targeted way, well, then that is really valuable. All right, and the best examples of that would probably be things like psychobiotics. If we really can create single strains that can help treat conditions like depression or anxiety or these sorts of problems, well then, there's going to be a massive market for those, 100%.